My wife, my daughter, my son wouldn't allow me to give up. They were the ones that championed my cause. My wife, she didn't take no for an answer. She just kept fighting. My name's Bob Fortin. I'm 59 years old. Been married for 37 years. I have 2 lovely children and a grandchild that is 18 months old. In July of 2022, I started to feel off. My stomach wasn't digesting food well. So they started putting me on different medications, thinking I had some sort of stomach ailment. Then in September, those drugs weren't working. As a matter of fact, they were making it worse. I wasn't able to go to work. I ended up having to stay home. I went into the doctor's office, kind of pounded the table and told him that you guys are missing something here. A doctor took some tests, which they hadn't run before, and my liver counts were off the charts. And Dartmouth went in with a biopsy on October 20th. And from there, I got my diagnosis a few days later, which was pancreatic cancer. It was just unbearable. I mean, the entire day, my wife was just absolutely a mess. Kids were a mess. I was a mess. Went through about 12 rounds of chemotherapy, then went through a pretty intense radiation treatment. And then from there, had a Whipple surgery to remove the tumor. Felt great for about a year. Had a month or so where things started to feel a little off. And then I was due for another scan. That scan, they determined that the cancer had returned and actually had spread to my liver. We were absolutely devastated. My wife, my daughter, my son, they weren't willing to accept what we were told, which was basically I had 6 to 9 months to live. So we called around, sent our files to Dana-Farber, to Sloan Kettering, as well to the Mayo Clinic. The Mayo Clinic was able to get me in the quickest. When we walked into his office, he was fully prepared, had everything in line for us on things that he recommended that we look at. And one of them was to contact the Dana-Farber folks for a clinical trial that was currently running.
Clinical trials have helped us enormously in trying to optimize this therapies for patients. Zenocutuzumab is a really clever drug. This drug actually binds to 2 proteins, and the reason this was so smart in binding both of those proteins is these proteins signal together. And so it made sense that you'd have a drug hitting both of those.
And once we got enrolled in the clinical trial, things started to turn around. It turned out to be fantastic. No side effects whatsoever. Everything went beautifully. I have the treatments, and literally the next day, I'm doing what I normally do, which is putter around the house, play with my granddaughter, play golf. My wife and kids have been absolutely spectacular from a support standpoint. My daughter essentially moved in with us to help take care of me because we thought things were going to head south fairly quickly. Thankfully, due to this drug, things have stabilized a little bit for us, so my outlook has changed. Every day I get to spend with my family is a blessing. My granddaughter is absolutely the light of my life. Just being able to get to know her, watch her grow up is just spectacular.
We were so grateful to Bob Fortin and patients like Bob who've been willing to go on this trial.
I've been on this clinical trial for about 8 months now. The cancer has essentially stopped spreading. I have treatments every 2 weeks, and then I get a scan every 6 weeks just to see if, what effect the drug is having.
And seeing a targeted therapy work in such an aggressive cancer like pancreas cancer, wow, that gave us a lot of optimism. That really helped shed that belief that maybe no targeted therapy would ever work in pancreas cancer.
So far, so good. So hopefully that continues. And then from there, once it stops working, I guess we hope that there's another trial that I can go on to extend things even further. The funding is absolutely necessary to develop new drugs like the drug that I'm on right now. I hope that with all the cuts that are going on in the world today in Congress, that this is one area that they leave alone and they continue to spend the money because we got to beat this disease. And the only way to do that is by funding it.